Hi guys! So today we're going to discuss about
Anemia! So, what is anemia?
Anemia is a condition in which you don't have enough healthy red blood cells to carry adequate oxygen to the body's tissues. Having anemia may make you feel tired and weak.
So there are many forms of anemia, each with its own cause.
Anemia can be temporary or long-term. It can range from mild to severe.
Causes of anemia.
So, what are the causes of anemia?
Anemia occurs when your blood doesn't have enough red blood cells. This can happen if
First, your body doesn't make enough red blood cells. Second is that bleeding causes you to lose red blood cells more quickly than they can be replaced, or your body destroys red blood cells.
So what red blood cells do? Your body makes three types of blood cells. White blood cells to fight infection, platelets to help your blood clot, and red blood cells to carry oxygen throughout your body.
So red blood cells contain hemoglobin. It is an iron-rich protein that gives blood its red color. It also enables red blood cells to carry oxygen from your lungs to all parts of the body and to carry carbon dioxide from other parts of the body to your lungs so that it can be exhaled.
Most blood cells, including red blood cells, are produced regularly in your bone marrow, a spongy material found within the cavities of many of your large bones. To produce hemoglobin and red blood cells, your body needs iron, vitamin B12, folate, and other nutrients from the foods you eat.
So let's proceed to the different types of anemia.
Iron deficiency anemia.
Iron deficiency anemia. This is the most common type of anemia worldwide. It is caused by a shortage of iron in your body. Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body can't produce enough hemoglobin for red blood cells. Without iron supplementation, this type of anemia occurs in pregnant women. It also is caused by blood loss, such as heavy menstrual bleeding, ulcer, cancer, and regular use of some over-the-counter pain relievers such as aspirin.
Vitamin deficiency anemia.
Vitamin deficiency anemia. In addition to iron, your body needs folate and vitamin B12 to produce enough healthy red blood cells. A diet lacking in this and other key nutrients can cause decreased red blood cell production. Additionally, some people may consume enough B12 but their bodies aren't able to process the vitamin. This can lead to vitamin deficiency anemia, also known as pernicious anemia.
Anemia of chronic disease.
Anemia of chronic disease. Certain diseases such as cancer, HIV or AIDS, rheumatoid arthritis, kidney, Crohn's disease, and other chronic inflammatory diseases can interfere with the production of red blood cells.
Aplastic anemia.
Aplastic anemia. This rare, life-threatening anemia occurs when your body doesn't produce enough red blood cells. The causes of this is infection, certain medicines, autoimmune diseases, and exposure to toxic chemicals.
Anemias associated with bone marrow disease.
Anemias associated with bone marrow disease. A variety of diseases such as leukemia, myelofibrosis can cause anemia by affecting blood production in your bone marrow. The effects of these types of cancer and cancer-like disorders vary from mild to life-threatening.
Hemolytic anemias.
Hemolytic anemias. This group of anemias develop when red blood cells are destroyed faster than the bone marrow can replace them. Certain blood diseases increase red blood cells destruction. You can inherit a hemolytic anemia or you can develop it later in life.
Sickle cell anemia.
Sickle cell anemia. This anemia is inherited. It is caused by a defective form of hemoglobin that forces red blood cells to assume an abnormal crescent shape. These irregular blood cells die prematurely, resulting in a chronic shortage of red blood cells.
Other anemias.
Other anemias. These are several forms of anemia, such as thalassemia.
Now let's proceed to the risk factors, complications, and preventions of anemia. Risk factors.
There are some factors which can increase the risk of anemia.
A diet lacking in certain vitamins. Having a diet that is consistently low in iron, vitamin B12, and folate increases your risk of anemia. Intestinal disorders. Having an intestinal disorder that affects the absorption of nutrients in your small intestine, such as Crohn's disease and celiac disease, puts you at risk of anemia. Menstruation. In general, women who haven't experienced menopause have a greater risk of iron deficiency anemia than do men and postmenopausal women. That's because menstruation causes the loss of red blood cells. Pregnancy. If you're pregnant and aren't taking a multivitamin with folic acid, you're at increased risk of anemia.
Chronic conditions.
If you have cancer, kidney failure, or another chronic condition, you may be at risk of anemia of chronic disease. These conditions can lead to a shortage of red blood cells. Slow, chronic blood loss from an ulcer or other source within your body can deplete your body's store of iron, leading to iron deficiency anemia. History of an inherited anemia, such as sickle cell anemia, you also may be at increased risk of that condition. Age. People over age 65 are at increased risk of anemia. Other factors. A history of certain infections, blood diseases, and autoimmune disorders, alcoholism, exposure to toxic chemicals, and the use of some medications can affect red blood cell production and lead to anemia.
Complications. When complications are left untreated, anemia can cause many health problems such as severe fatigue. When anemia is severe enough, you may be so tired that you can't complete everyday tasks. Pregnancy complications. Pregnant women with folate deficiency anemia may be more likely to experience complications such as premature birth. Heart problems. Anemia can lead to a rapid or irregular heartbeat. When you're anemic, your heart must pump more blood to compensate for the lack of oxygen in the blood. This can lead to an enlarged heart or heart failure. Death. Some inherited anemias, such as sickle cell anemia, can be serious and lead to life-threatening complications. Losing a lot of blood quickly results in acute, severe anemia and can be fatal.
How to prevent anemia? Eat a vitamin-rich diet. Many types of anemia can be prevented, but iron deficiency anemia and vitamin deficiency anemias can be avoided by having a diet that includes a variety of vitamins and nutrients, including iron. Iron-rich foods, including beef and other meats, beans, lentils, iron-fortified cereals, dark green leafy vegetables, and dried fruit. Folate. This nutrient and its synthetic form, folic acid, can be found in fruits and fruit juices, dark green leafy vegetables, green peas, kidney beans, peanuts, and enriched grain products such as bread, cereals, pasta, and rice. Vitamin B12. Foods rich in vitamin B12 include meat, dairy products, and fortified cereal and soy products. Vitamin C. Foods rich in vitamin C include citrus, juices, peppers, broccoli, tomatoes, melons, and strawberries. These items help increase iron absorption.
Consider a multivitamin. If you are concerned about getting enough vitamins from the food you eat, ask your doctor whether a multivitamin may be right for you. Consider genetic counseling. If you have a family history of an inherited anemia, such as sickle cell anemia or thalassemia, talk to your doctor and possibly a genetic counselor about your risk and what risk you may pass on to your children.
Let's proceed to the symptoms.
Anemia signs and symptoms vary depending on the cause of your anemia. They may include
Fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath or dyspnea, dizziness or lightheadedness, chest pain, cold hands and feet, headache. At first, anemia can be so mild that it goes unnoticed. But symptoms worsen as anemia worsens.
So guys, see your doctor if you suspect you have anemia, because this can be a warning sign of serious illness.
Take note.
Make an appointment with your doctor if you're feeling fatigue for anemia results. Some anemias such as vitamin B12 deficiency and iron deficiency anemia may be common. Fatigue has many causes besides anemia, so don't assume that if you're tired, you're anemia. Some people learn that their hemoglobin is low, which indicates anemia when they go to donate blood. If you're told that you can't donate blood because of low hemoglobin, make an appointment with your doctor.
It is true that the iron storage of vegetarian is less than the iron storage of non-vegetarian. But does this statement prove the generally accepted belief that vegetarian is more prone to have anemia than non-vegetarians?
No, it does not. According to hematologists, iron deficiency anemia is no more common among vegans than among the general population. Vegetarians do not eat meat, fish, or eggs, which are sources of high iron and vitamin B12, which makes healthy red blood cells. However, they can easily compensate their lower iron intake by taking a balanced meal diet.
Many vegetables with rich iron and vitamin C can do wonders and can actually provide an edge over the non-vegetarian food items. Vitamin C increases the absorption of non-heme iron 6-fold, making it equivalent or better than the heme iron present in meat. Ironically, dairy products like milk and eggs provide no iron and can block the iron absorption in the body. Also, pumpkin seeds, sunflower seeds, pulses, dark green leafy vegetables, beans are some of the foods which are high in iron than in meat. Vegetables such as broccoli and bok choy are high in iron and vitamin C, which leads the increased absorption of iron in the body.
And that's it for anemia!
Bye!
If you want us to make another video about leukemia,
Subscribe to our YouTube channel
And like this video.
Bye!
Bye!